I feel really strongly that every orthodontist should incorporate mini screws into their mechanics because they allow you to do things that you've never done before. It allows us to treat cases with fewer appointments, with more predictability, and overall shorten treatment times as well.
Well, if I can cut 6 months off of treatment on an average case and end up with as good a result as I would if I had excellent cooperation, that's huge. That's absolutely huge.
Mini screws are so easy to place, and there's no reason that clinicians shouldn't feel confident placing them in their patients. And I think the whole idea is having some control over what you're doing in your practice. And for us, this gives the control back to the clinician. It's not in the patient's hands. It's in our hands.
I've been working with compliance issues for 30 years in orthodontics, and I realized that it's just impossible to get good results without being able to control some of these things, and this is a way of having better control.
I've been using mini screws now for about 4 or 5 years, and at first I was a little tentative just because I wasn't really sure what I could do with them. The Vector system is so well organized that makes the entire process just seamlessly integrated into our normal day.
I really believe that orthodontists ought to be the practitioners who are placing mini screws. Orthodontists have the unique understanding of biomechanics necessary to perform the movements that they are anticipating doing with their mini screws. Placement procedures for mini screws are so simple, there's no reason that orthodontists shouldn't be placing these screws in their office.
More doctors should be using mini screws because they are easy to use, and it allows us to do things that we couldn't do before in orthodontics.
The more that practitioners are getting comfortable with mini screws, the more they're finding broad application for mini screw usage on a daily basis. Posterior intrusion of maxillary teeth to close open bites, molar uprighting, molar intrusion in areas of adult rehabilitation and restoration, en masse anterior tooth retraction, posterior tooth protraction, just a few of the things that we're able to do.
You can use them for the more common cases, and that's what I've been doing a lot in my practice. Because they are more efficient and I feel that I have more control. But also more difficult cases that maybe would have been a surgical case, you can now use a mini screw to do things that we couldn't do before.
Depending on the type of patient, the payoff for the patient in having a screw utilized in their treatment is that many times we can avoid jaw surgery. Many times we can accomplish orthodontic movements that we could not have accomplished before, or accomplish those same movements much more quickly than we could before.
I can't tell you the number of cases that we've treated over the past few years with mini screws that would have otherwise ended up in the oral surgeon's office.
We had one patient come in and her upper arch was canted, and so she'd had other opinions where they wanted to do surgery on her. And she came in and we decided to use the Vector anchorage system and putting them in her upper arch, tying some elastics, some wires up to it, and we leveled her smile out beautifully. She was so excited she didn't have to have surgery.
We once did reserve mini screws for the most difficult cases of surgery or patient non-compliance. Today we have learned that we're able to use mini screws on a daily basis with routine patients in situations where we are able to maximize our treatment efficiency by maximizing the anchorage that mini screws provide.
I think the TAS should definitely be a rule, not an exception, because of the quick turnaround time that they can bring for patients. They're all about when they can get their braces off, how fast treatment is.
Mini screws are the wave of the future in orthodontics. I think that as more and more people realize how easy they are to place, they're going to start utilizing them in their practice as well, and just find that they can do things that they couldn't do before.
This is the most revolutionary thing that has happened to orthodontics, at least that I've ever seen.